Fainting is something you can come across in all sorts of situations, as people faint for different reasons. There can be different triggers or causes of someone fainting. It could be they have not eaten much recently, or they could be overexerted, be pregnant, or under pressure, or maybe they just get up too quickly. When someone faints, it's because there's not enough oxygen-rich blood in their brain. What's happening is your brain is telling you need more oxygen, and it makes you feel dizzy or lightheaded. By feeling odd, you would sit down or lay down, which helps provide more blood to the brain. If you ignore these symptoms, or it's more serious, you faint. In this scenario, we're looking at a simple faint and not where injuries are caused on the fall.
Oh, Vivian, what have you done? Are you all right?
I think I must have fainted.
Oh dear, roll onto your back a bit. Can you do that? That's all right.
Yes.
I'll just put some cushions under your feet.
When you have someone who has fainted, you need to approach them safely. Often when someone has fainted, they'll hit the ground and then quickly they'll start to come round as the blood flow gets back to the brain. They might be embarrassed, scared, or all sorts of emotions could be going on. Even if the person comes round quickly, keep them on the floor and elevate their legs to allow more blood to drain to the vital organs. If they're still unconscious when they're on the floor, elevate their legs 15 to 30 centimetres and they should come round quickly. If the patient starts feeling better and after a few minutes have passed, you can assist them up to sitting or then standing. There is no rule for how long before they can stand up. Use your judgment and talk to the patient. From a laying position, ask them to sit up, and then when they're ready, sit them onto a chair. And only when they're ready, they can then stand. You may need to help guide them until they're fully recovered. If they get up too quickly, they may faint again. If they feel unwell at any time, sit them down or lay them down again. If they don't recover, call the EMS. If a patient faints on a regular basis, this is best checked out by a doctor, as it may be a symptom of another medical condition.